Over the last 24 hours, we identified 531 new cases of COVID-19 and completed about 10,200 tests. Our positivity rate was about 5.4%. There are currently active alerts or outbreaks in 245 schools. Of these, 3 schools had 10 or more COVID cases who attended in the last 14 days while infectious. We continue to see a slow and steady decline in hospitalizations, and there are currently 779 people in hospital, including 185 in the ICU. Sadly, I must announce that 12 new deaths were reported to Alberta Health in the last 24 hours. I extend my condolences to those mourning the passing of these people and to anyone who has recently lost someone they cared about, no matter the cause. We're looking at the fall numbers. We saw, of course, an impact from Thanksgiving that seemed to be exacerbated by Halloween and social gatherings. At this time last year, we did not have the same kinds of measures in place that we do this year. So just as it was in our collective hands at Thanksgiving, the same is true of Halloween, and the more that we can, again, encourage everyone around us to be fully immunized, the more we can follow the public health measures in place, the less likely it is that Halloween would be a spike or super spreading event. So we'll, again, do our collective best to protect each other, to protect our neighbors, and to have the same outcome as we're currently seeing from Thanksgiving. We're not seeing that spike, and so we'll aim for that same thing with Halloween. It's really difficult to predict what will happen this year with influenza. We know that the measures that we used last year against COVID worked extremely well against influenza. As you likely know, we tested more influenza samples than we ever have before, and yet had absolutely no seasonal influenza in the province detected. So this year we do have 3 confirmed cases to date, and we are, of course, rolling out our influenza immunization campaign. So what influenza will look like this year will depend on a few things. One is, of course, we continue to have measures against COVID. As we continue to have significant impact, that should also help to mitigate influenza spread to some extent. The same kinds of things that we're advising for COVID, staying home when sick, washing hands regularly, those things will also help prevent influenza spread. And of course, the more people who step forward to be part of the protection that vaccine offers, the more additional layers of protection we'll have. So it's very difficult to predict at this point. We'll have to watch closely as the season unfolds, and we know that having had no influenza last year, if there are significant transmission events, there could be significant consequences and cases that have an additional impact on the acute care system. But if we all continue to follow these preventive measures, we can protect each other not just from COVID, but also from influenza. There are 2 things that impact the transmission rate in the province. One is our vaccination rate, and the other is the overall number of transmission events where someone who's susceptible is exposed to someone who's infectious. And that second piece is heavily influenced by how many people are in contact with others outside their household every day, how many of those in-person interactions happen. As you know, we put in measures on September 20th that significantly reduced the number of in-person interactions happening in many different venues. And the restriction exemption program, which did 2 things. First of all, it provided additional incentive for people who may have been willing to be vaccinated but just hadn't gotten around to it yet to go and access the protection that vaccines offer. So that increases that vaccination coverage, and it also creates opportunities so that those spaces covered by proof of vaccination for participating venues, that those spaces now have the people in person who are much more likely to be protected. Again, the people who aren't vaccinated can provide proof of a recent negative test, which lowers the likelihood of an infectious person attending, doesn't eliminate it, but lowers it. So I think the combination of reducing the number of in-person interactions that happened, as well as increasing vaccination rates, have provided a combination that has reduced our cases, reduce transmission and is slowly reducing acute care impact. But I do want to emphasize that we continue to have a high acute care burden. So we do need to continue all of those things, continue increasing vaccination coverage and continue reducing our in-person interactions so that we can get our acute care system out of this difficult spot.